Hello and welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. I'm Chuck Jones with Synergy Broadcast, and I want to welcome our expert guest, Fran London. Hi, Fran.
Hi, Chuck.
Fran is the patient education specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she's also the author of the book No Time to Teach, which is the source of so many of our topics here on the Patient Educators Update. And Fran, we're going to continue on with a series that we started a couple of episodes ago, where from the summary of your book, you talked about a couple of topics that you wanted to make sure that patient educators did. So far we've talked about informed consent, we've talked about self-care and how to recognize problems. And if folks miss those episodes, I'd encourage you to go take a look at those. And we'll put links to the episodes. Today, we want to cover the last one of the four that you mentioned, and that is about answering questions. And this one might seem like a simple thing, but my experience and my expectation is it can be easily overlooked or brushed off for a couple of reasons. Number one, and the most common one we talk about, is the patient's afraid to ask a question because they don't want to appear stupid or whatever. They may not know what questions to ask, which is something that I have faced before. Then the other one is that they take the approach, well, if there's something I should know, the nurse or the doctor will tell me. And of course, that's not always the case because because the doctor or the nurse, they see so many patients during the day. And then one of the final ones is kind of the mental state. They've just been given information and it's maybe not good, so they're anxious, they suddenly are confused, they're upset, they're worried. A whole list of things can go across their minds, and one that's not is, well, what questions should I ask? They don't think about the who, the what, the why, or whatever. Help us understand a little bit about this issue, and then we can maybe talk about what to do about it.
Well, all your points were really good and quite accurate. I think one of the key things to think about with answering questions is if we're trying to improve patient engagement. Certainly questions are a great way to engage the patient in the healthcare experience. So based on what you said, it's really important to pay attention to the patient and to try to pick up cues, looking to see how their emotional state is or how shy they are or how confused they might be, and try to hone into that and encourage questions within the context of the conversation.
Yeah, but one of the things that I've seen, and probably the most common experience, is the question that the nurse or the doctor will ask is, do you have any questions? And the immediate response is, well, no. I don't.
Right.
I don't. But that's not really the question they should ask, is it?
It's not the best question to get questions.
Yeah.
It's certainly more effective to say something like, what questions do you have?
Mm-hmm.
Because that doesn't imply there might not be any.
Right.
It's implying that there is something, and which ones are they?
Mm-hmm.
Another way to approach it is to suggest that lots of patients in your situations have questions about diet or exercise or whatever, medications or side effects. And if you suggest a question topic that is common with that patient population, you might at least open the door where even if the patient doesn't have a question about that topic, they feel comfortable asking a question about something else.
Yeah. Yeah. Now, you could also use some of your most effective tools where it comes to either to assessment or teach back, because those can be used to at least get the patient talking, because one of the immediate problems you're going to have is the patient's not going to want to talk because they're processing, right?
Oh, yeah, you can't do both at the same time very well. So you have to give them time to think about what's going on, and maybe the question thing has to happen in a couple of sessions, especially if you're in the hospital and you're running in and out of the patient room. You can start the conversation at one point and come back when they've had some time to think about it and might come up with a question. You also have to when they do have a question, take it very seriously and answer it thoroughly, and um, make sure they're comfortable with what the response is, that they understand it and that it met their needs. Because if you blow off one question, then they're not going to be comfortable asking something else.
Right.
So you really have to set the stage where it's an expectation that they will be expected to ask questions and that you will respect that and give them the best answer possible.
Yeah, and I think demeanor is real important here from the professional standpoint, because so often, especially in a hospital environment, the doctor comes in, basically says, here's what we're going to do, and then begins to take steps to the door saying, are there any questions? Clearly he or she is in a hurry and wants to get after it. And so that's not really conducive, because the first thing you say, well, I'm imposing on her time. I don't want him or her to, I don't want to stop them from saving a life or whatever they're doing. My questions can't be important. And so boom, out the door they are. But having a more relaxed, focused demeanor, I think would help.
Yeah, paying attention and acting like you really do want to hear and answer.
Yeah. And from a nursing standpoint, so in the times that I've been in the hospital with the wife or the mother, generally the only time two nurses come in is when there's a shift change, bed shift change. The rest of the time it's usually only one nurse. Is there ever a time where the nurse comes in and there's a supervisory nurse that's following along? We used to call them ride-alongs when I was in outside sales, where your boss would go with you and he would observe all day long and try to help you do a better job, whether it was listening, answering questions, making your presentation, or whatever. Does that happen very often in the hospital environment, where there's a nursing supervisor doing a, quote, ride-along with the staff nurse to make sure they're doing a good job and help them?
Oh, yeah, that can happen. It depends on usually the supervisor's style. There are some that do it a lot and some that hardly ever do it at all. But it's really the best way for the supervisor to evaluate the nurse's work.
Yeah.
If you have to see it in action.
Yeah, no doubt, no doubt. Do you have any specific advice, especially for younger nurses, in terms of what they can do to make the patient feel a little bit more at ease? If we talked about them being anxious or nervous or whatever, whether they're, in the doctor's office or in the hospital, those are two very different environments. I mean, I'm more anxious when I'm in the hospital than when I'm in the doctor's office. So are there any tips on how to make the patient feel a little bit more comfortable?
Well, you might be more anxious in the hospital, but you might also feel more pressured in a doctor's appointment because they seem to be quite rushed and that they can't spend much time with you. So you still have that issue of how can I get the question out and get an answer in this short time?
Yeah, good point.
They're both issues. And I think the key is really listening. If you can pay attention a little bit better and see the cues and listen to the concerns, even if they're hidden within a statement or a response to something you say, then you might be able to encourage a question if you can, well, what did you think when I said that? Or what are your concerns when I talk about this? Or what are you most worried about? Those kinds of things that are the result of you paying attention and picking up on cues can really get the patient comfortable because they know you're listening to them and you're paying attention and that you're willing to go the next step and answer their questions. And it also gives them permission. So many people are afraid that they're asking stupid questions, that they don't know enough and you're going to think they're silly. And it's really important to make that not an issue.
Yeah, okay, all good advice. Well, that's about the end of our time today. So why don't you tell folks how they can find you online?
Oh, I've got a blog at www.notimetoteach, and I'm on Twitter at NoTimeToTeach.
Okay. And I want to let folks know that your book, No Time to Teach, is available at Amazon and other bookstores and book e-tailers, and it's available both in paperback form and also in downloadable form for Kindle. It's a great read, great compact, what am I looking for? How-to book. And for those that are interested in perhaps using No Time to Teach as part of an in-service training, if you visit Fran's publisher, Pritchett and Hull, and their website is p-h.com, you can get a 40% discount on bulk purchases. It'll save you a bunch of money to do some group training. For those of you who are interested in ramping up your patient education by adding video, it's a great tool for nurses, helps them save time and get a little bit better engagement with patients. You can learn more about video and video on demand at our website, synergybroadcast.com, and our system is called MMDS, or Medical Media Delivery System. So Fran, thank you so much for your time today. Great advice on answering questions. And we'll put links to the other episodes that we've talked about previously on informed consent, self-care, and how to recognize problems. So thanks so much. Expert advice is always welcome and appreciated. And so we'll talk to you next time.
Okay. Bye, Chuck.
Bye-bye.